Good afternoon, Raymond. Meneses from Legal Management Consulting. My good friend, how are you?
I'm well, thank you. Great to be with you again.
Likewise, likewise. So there've been a couple of updates since we last spoke. We've walked a couple of companies through the various different stages of lockdown. We're now sitting at lockdown level 2. So I think it's good for us to have a conversation and chat around some of the legal imperatives that we need to consider, and
Sure.
also some of the health and safety stuff from my side. So without further ado, I'm going to open up the regulations and let's have a look. So if I look at, you've got sections 49 and 50, here's something interesting that I picked up in 50. So I have flown a couple of times recently, and whenever I fly, I've got to have the national health form completed and I've got to have my permit with me. So one would assume by what they're saying here in the movement of persons is that you only have to be in possession of a permit if you are a person moving around between the hours of 10 o'clock at night and 4 o'clock in the morning. Therefore, permits are not applicable to those other people. Is that true? Where are we on the permits?
That's how I would read it.
Yeah.
Whether that's how the state is going to read it or individual government officials going to read it remains to be seen. We don't know.
Yeah.
But that's certainly how I would read it, that you're only required to have a permit on you because we're basically back to close to normal as far as freedom of movement is concerned, for in the instance of international travel. So it seems that you need a permit if you're going to be traveling around beyond the curfew hours.
Yeah, 100%. So put it this way, if I'm traveling on Monday, I'm still going to have my permit with me just in case. But however, that's the way that I would interpret it, is that you don't need a permit unless you're working between those particular hours. Obviously now, I think there was a debate in some of the other levels of lockdown as to whether masks were mandatory. Obviously, masks have now been mandatory for some time. It obviously depends how you wear your mask and how much of your... I really have to... Well, I know we shouldn't be laughing. It's quite sad.
We despair.
It's like a small cloth over somebody's mouth, still exposing other parts of their body. And there have been some interesting memes about that. I don't know if you've seen them.
I associate myself completely with it.
Yeah, 100%. So wearing of masks is mandatory. So any public place, and I think it'll be interesting, there now seems to be the requirement that the employer has to enforce that as well. If you're not wearing it, if you're an employer or a retail space owner, you can't let people into the premises if they're not wearing a mask. So
yes,
out you go if you're not wearing it. Attendance at funerals, I don't think it's really necessary for us to engage on. I do think it might be interesting for us to just play around with this discussion that we had earlier. Is the government is obviously being quite stringent with regards to evictions and demolitions for residents.
Yeah.
Might be good to chat around what we spoke about earlier. What happens if you're in a commercial environment and somebody wants to evict you?
Okay. So the legal position, remember, remains that nobody can be evicted from any place without a court order. What this regulation appears to mean is that a court, in considering an application for an eviction, is going to give greater consideration to individuals being evicted from their homes or from land that they occupy, as opposed to potentially commercial situations. Commercial situations where a landlord may well be in a position to evict a commercial tenant.
Yeah. And
that makes sense. Individuals are being massively affected in their incomes, or not that businesses aren't, I must say, but and it's going to increase social distress to have people out on the street or evicted from land that they've occupied before this all settles down.
Right. So if we jump forward to regulation 55,
yeah,
so gatherings, and this is kind of the hot spot at the moment.
Yeah.
Obviously, all persons have got to wear masks, so it's the 3 Ws. wear your mask, wash your hands, and watch your social distancing. I always like that. I like the 3 W's.
Yes.
So I think it's also quite interesting that the government might have kind of, who knows, accidentally on purpose put it in there. All gatherings are prohibited. So that means if you want to get together to moan or strike or do any of those, all gatherings are prohibited, except this list of gatherings. So, I mean, if people got really upset and they did want to march, they've obviously got various different things that they need to consider. Now, here's obviously somewhere that we're both involved. Faith-based institutions, which is limited to 50 persons or less, depending on the size of the place of worship. So if you're meeting in a tent and it's a small environment, although you've been given the mandate to meet up to 50 people, you need to consider the size of the environment and the risk before extending it to that amount of people.
Yes.
100%. So
absolutely.
Sorry, Ray?
Yeah, no, I agree. So that doesn't mean that if you've got a really big space, you can have more than 50. The upper limit is always 50.
Yeah. Now, I think where the complaint has come in here from faith-based institutions, because if you go a little bit lower down, casinos are allowed to operate at 50% of their floor space.
Yeah, bizarre, hey?
Yeah, so there are obviously some large faith-based organizations that could fit a lot more than 50 people in, but yeah.
In 50% of their floor space, yeah.
Yeah, and don't use 50% of their floor space, but yeah, anyway, I think that's where a lot of people are asking questions at the moment. So, and again, conferences and meetings allowed up to 50 people. Obviously, people are being encouraged to participate through electronic platforms. Cinemas, again, up to 50 people. I don't know if I'd be in a rush to go to a cinema right now and sit in an enclosed
environment. Not a chance.
Yeah. But one of the things that I'll throw out from a health and safety perspective that we'll go into a little bit later is the employer or the organization needs to assess the effectiveness of the controls. So here's what I think a lot of employers need to consider is a lot of the controls that we'll speak of there are engineering or mechanical based controls. So if we are utilizing good ventilation in a confined space, guys are going to have to assess that, and they're going to have to assess what are the airflow rates for the number of people in there. Now, to be honest with you, I don't think a lot of employers are going to that extent of, it's just, I mean, the cinema is not going to open their windows. So if people are in the cinema and they have to interrogate the effectiveness of their controls, you know, getting in an occupational hygienist to look at your airflow rates and your extraction system. Yeah, all of that stuff. Now, obviously, the aeroplanes, I mean, I've caught a couple of flights now, and from the first flights that I caught where there was a space in the middle, I've been on a couple of flights recently that are absolutely jam-packed like sardines. There's not a
really
playing card between you. I've been on 2 Mango flights now where all 3 seats on either side are absolutely full. But they revert back to the fact that they've got those HEPA filters, I think that's what they're called, which have got a great filtration capability. But, I mean, needless to say, you're sitting 30 centimeters away from somebody else's mouth, although everybody does have to wear a mask.
Yeah, that doesn't excite me, I've got to say.
No.
I'll be traveling next week, and that's not great.
Have you got, hopefully you've got some good KN95s or something to wear. If you don't, let me know. We'll send some your direction.
I know a guy, I'll speak to him.
You know a guy. Okay, so all social events, weddings, and again, one of the discussions that I thought we were going to have here is, like President Cyril Ramaphosa said, just because you can doesn't mean you should.
Yeah.
And maybe you could give us your perspective on, you know, we've been brought down to level 2. What are the primary motivations behind this?
Yeah. So I think this is a recognition of the massive impact this is having on people's lives, both in terms of finances, people need to be able to work and get around, and morale, but also in terms of social distress. I think that it's very difficult for a nation to remain under this kind of stricture without there being serious social consequences. So I think that the government has been relaxing them, notwithstanding the fact, I think, that we are nowhere near out of the danger zone. Our death rates have plateaued for a while, but I think that we're going to see a huge spike 14 days, 2 weeks, within 2 weeks of the 18th of August. And if you look at every major epidemic, you look at the 1918 Spanish flu, and you look at what has happened in other countries in this pandemic, it's a camel with two humps, not one.
Yeah.
And in some instances, the second hump is much bigger if you're looking at death rates. I mean, I personally know three people who died in the last 3 weeks.
Sure.
All senior people, older guys, and they died of COVID. And so I've spoken to friends who said, "Yeah, but Raymond, I'm not old, so I'm at less of a risk." Yeah, you are, but if you come into contact with somebody who is of greater risk, you can kill them.
Yeah.
Not to put too fine a point on it, it's a constant wrestle, because you want to have social contact. It's a basic human need, whether it's in terms of a church gathering or meeting with friends or birthday events or whatever. That's a real need. We're designed for connection, but that connection shouldn't result in people dying if you can avoid it.
Yeah.
I had a very interesting chat with a doctor recently who said of the 1,200 employees at Inkosi Albert Lutuli Hospital, 200 became positive. So they conducted a massive investigation, which they're obliged to do. They're obliged to do a risk assessment after such massive failure. And they discovered that none of the infections could be traced back to contact with a COVID positive patient. It appears, and obviously there may be exceptions to this, but it appears that all of the infections arose out of contacts in the canteen with baby showers, birthdays, things like that. Because when the medical workers were in their professional context, they were masked, gloved, and sanitized. When they were in the canteen, they were hugging their mates and sitting close to each other and ignoring safety protocols. Not all of them, but sufficiently enough to have a massive outbreak. And that's catastrophic. 200 out of 1,200 employees. Yeah. And obviously that has a knock-on effect, because they go home and they live with people and have social contact with people, and then those individuals can become infected. So I think it's a mistake to let our guards down here and think that we're heading back to normal because the restrictions are lifting.
Yeah.
I think we've got to be conscious of that.
Sure. So when I look at this, there's a couple of things that have informed my thought process, and I'm aware of an example last week where 2 senior managers in an organization were COVID positive, both relatively the same age and health, etc. One of the gentlemen was working from home for 10 days, headache, stomach issues, etc. Recovered fully, and the other manager ended up in ICU and passed away this week. So I think a lot of people's appetite for risk or how they respond to risk is informed by such an amount of stimulus in the market and information that people are receiving. And the majority of people who are infected are reporting headaches, very limited fever, etc. Now, we know that that's informed by the viral load. So there are young people who have been healthy, who have been exposed to a large viral load and have been significantly affected. But the majority of infections, the large majority of infections, have been low in terms of symptoms and low in terms of the effect. Like, people hardly even knew that they had it, bar the fact that they went for a test. Now, what that's doing is that is informing people's appropriation of risk and how they respond to it. Now, I reiterate what you've said just now, is that we need to respond not necessarily based on ourselves, but on the worst case scenario that can occur, not to us, but the people that we come into contact with. And the challenge is that we're not. We're doing it based on the majority of symptoms that are occurring to people, which is factual, it's evidence-based. I don't think there's any dispute over the limited effect of what COVID has in the majority of cases. The problem is are we going to take responsibility for protecting the weaker amongst us? And the most importantly is, where we can all participate, is reducing the potential of that viral load. And I think, again,
Agreed.
despite all the disparate opinion, I think the medical community is relatively united on the fact that people's symptoms are relatively low unless they are exposed to a large viral load.
And there are just two additional comments I'd like to make on that. The one is, and I accept that this is anecdotal. I don't have any evidence beyond what I've been told. But my understanding from some of the people I've spoken to in the medical community is one of the difficulties that government hospitals are experiencing is that people are dying in the waiting rooms. Because there's a social stigma attached to the disease, many people are not coming to hospital until they're really, really ill. And they die. They literally die in the waiting area, which is creating a disaster, because then you have to decontaminate, and there's a high contact with the people they've been sitting in the waiting room with, and you can imagine that's cataclysmic. And it's not just old people; it's people who have a compromised immune system for any number of reasons, and we have a very high incidence of that in South Africa, especially if you consider our TB rate.
Sure.
So that's one thing. Secondly, we tend to describe the effects of COVID either in terms of death on the one hand or low symptoms on the other. But one of the things that is emerging across the world as people are assessing the long-term effects of this disease is people who've had it fairly seriously, and that's not a small number, are experiencing the consequences of the symptoms for months, many months afterwards.
So post-viral infections.
Not only, absolutely, post-viral infections, but it's got other sequelae because it's primarily based on embolisms, lodging in lungs, heart, brain, elsewhere. It's having consequences such as severe depression, fatigue, malaise, any number of things that are going to have a significant effect on that person's ability to work and to engage actively in society. So I think we're going to see long-term effects of this beyond either death on one side or limited symptoms on the other. There's more to this than we're seeing.
There's a term for that, I believe, and I think they're calling it long haulers.
Yes.
So people have been affected for quite some time, and I know a couple of those people who've literally been affected for 3 months now, and it manifests itself in a lot of the symptoms that are similar to ME and yuppie flu and chronic fatigue type issues.
That's devastating.
So on to a more positive note, I think something that you and I are both going to celebrate: beaches.
Yes.
Are open again. So we can again.
I'm very excited.
Yes, we have been able to fish for a while, but beaches are now open again, which I am greatly, greatly, greatly appreciative of. I don't think either of us are going to miss the shebeens and the bars or whatever that have opened up, because it's not really a context point for us, but we can visit the library. Obviously, here's an interesting thing: prohibition of initiation practices. So obviously relevant within the Xhosa community, etc. So it's interesting that they seem to have put some tighter controls around those issues. One of the other things that I thought might be relevant of mentioning is, I believe a lot of people as well have also been reluctant to wear masks because of the social stigma. Historically, I think a lot of people who had TB and HIV and AIDS wore masks. Or didn't want to wear masks because of the association as well. So, there's so many contexts, cultural and social, that we need to take into consideration. I wonder when the borders are going to open. I think that's going to be...
that's a very important question. I don't know.
I mean, I look at some of our surrounding countries, and I look at Mozambique, and I would say one of the greater contributors to investment would be the tourist industry. So December's coming. I wonder if the border, I might be saying this from a slightly selfish perspective, but I wonder if the border is going to open up to Mozambique for those types of things. Sorry, say that again, Ray?
No, I'm saying it's difficult to say. It's such a complex issue.
So public transport, obviously there's been a lot of wrangling around public transport, and
Yeah.
long distance travel is now considered anything over 200 kilometers. So interprovincial travel is now open. People can now go and visit relatives. There's a certain amount of socialization that is allowed to occur under level 2 in people's houses, etc. But again, to echo the president's sentiments, just because you can doesn't mean you should.
Yeah.
Bottle stores are now open up again. And again, I think there was obviously a relatively good reason, supported by the medical community, for closing that down for a while, in terms of the number of people that were taking up beds from alcohol-related issues rather than people who had COVID.
Yeah.
Now, here's an interesting one. Regulation 62, the operation of the economic sector. Businesses with more than 100 employees. Now, I've been dealing with quite a few call centers over the COVID period. Businesses with more than 100 employees working together in a group in the same floor must, where possible, make provision for them, minimizing the number of employees at the workspace at any given time through rotation, staggering work hours, shift systems, remote working, social distancing to limit congestion. So, again, it's quite interesting. The frame of reference for the regulation seems to be more on stimulating the economy than any of those other social organizations. So churches, for instance, or faith-based organizations that are contributing to society. So businesses obviously can have those types of meetings. Health protocols, social distancing, and again, now this is quite interesting. Relevant health protocols and social distancing measures for persons employed in private residences must be adhered to. So if guys working from home. Now,
and
this
also
is
domestic workers.
Sorry, say that again, Ray?
And domestic workers.
And domestic workers. So again, Regulation 5, I think, is something that I don't think a lot of people have been familiar with. So employers must implement appropriate measures for employees who are over the age of 60. Now, I think we've discussed this before, where I think there was a common misnomer that if you were over 60, you couldn't work.
Yeah, not the case.
So it's not the case at all. So if you're over 60, the employer must give you the option. So you can either work from home or come to work. But obviously, if you are going to come to work, the employer needs to take special precautions around what your particular comorbidity could be.
Yeah, and now, there's a guideline on that that's been issued by the state. It's available on the government printer's website for free. You can download it.
Yeah. Now, one of the ones that I did want to pull out here is Regulation 6D. I'd be interested to see how much of this is actually taking place. So obviously, larger companies, construction, manufacturing, those over 500 are responsible for doing those daily symptom screening. But D says that they must submit the data collected during the screening and testing process to the Director General for Health. I wonder how much of that is taking place, because then again, there's such variety.
Yeah, who knows, man?
Yeah.
And what do they do with the data is very difficult to know.
Yeah, yeah. And again, I mean, I would ask a question, I would assume that there are many COVID cases that are taking place in businesses that aren't even being reported.
Oh, yeah.
Absolutely. One would assume.
Yeah.
And then on the back end of that, I mean, if a business does report it, maybe an honest conversation here is, other than for statistical analysis, what's going to happen? I mean, they report it through to the Department of Labor, the Department of Health. They've had a couple of cases. There are so many cases out there that I doubt they even have the capability to be able to respond. So you're reporting it for what purpose? Statistical analysis primarily.
I remember at the outset, the track and trace is working pretty well. I don't know how it's going now. I imagine that the system's probably overwhelmed. I don't know.
Yeah. So are you, maybe just from a labor law perspective, are there any trends that are going on out there in the marketplace at the moment, either retrenchments or anything interesting that you can think of, people being dismissed for whatever reasons? What's happening out there, right?
Okay, so well, there have been two major trends that I've noticed. The one is because of the economic impact of COVID and what's happening globally in economic terms, is people are restructuring and retrenching. I have already retrenched half the workforce of 2 employers. I've been assisting on a number of mass retrenchments. So there's significant retrenchments taking place, which is devastating. That's certainly happening. Then there have been quite a few instances where I've had to help clients who've had complications in respect of employees working from home. Either they have comorbidities and they're not able to return to work at all, and then there's an incapacity termination, possibly, or they've had severe COVID and they're not able to return to work. That's potentially an incapacity termination. But also, some people have been working from home and there are less controls in place, so it's affected performance, or guys who have psychological issues or drug or alcohol issues. That's created significant problems. People are depressed, people are anxious, and those all play into medical incapacity and potentially termination. So that's certainly happening. On the positive side, many employers have realized that they can actually get a lot done with people working from home. And they're looking creatively at streamlining processes and rationalizing processes and being more productive. And also, there's been a recognition that they can get a lot of work done with fewer employees. Now, that's negative in that some employees will be retrenched, but it's very positive in terms of having more streamlined operations and more effective business controls. So it's been really interesting from that perspective. I think this has changed the way that business will operate forever.
I'd put it this way: I'd hate to be in commercial property right now.
Yeah,
I know several businesses.
True story.
Yeah, that have downscaled significantly. Most employees are operating from home 2 to 3 days out of the week, coming into a smaller, leaner, downscaled office. However, I have a sense that some of the chickens are going to come home to roost as well, particularly in an online space. So I've been doing a lot of remote auditing as well. So particularly when I'm auditing and I'm asking guys questions, etc. If I'm auditing and I'm discussing with you and I've only got audio because I can't see, how much of human communication is nonverbal? So I'm looking at your face. Yeah. You could be saying one thing that's coming out of your mouth. There's something totally different is appearing on your face. So I have a concern with some of the aspects of remote work. And I do a lot of online training with groups. And what happens is everybody turns their video off. And we all know what's happening. Guys are sitting there answering their emails, and there's a level of distraction that's coming into this as well. And I think we're going to have to come up with some better approaches for how we do this online connectivity.
Agreed.
Yeah, but I think those mental health issues, the disconnectedness, how do we still maintain cohesive organizational cultures that are effective for people in an online space? And I think those are some big questions.
Yeah, and how do we deal psychologically with the fact that people are facing questions of redundancy? Traditional models of an employee being able to work until retirement in the same line, in the same kind of position with occasional escalation as they're promoted, where those positions will no longer exist. How do we deal with that? It's going to have long-term effects. It's very difficult.
But within that, I also believe that there's an incredible opportunity as well, is with the reset. There's an opportunity to restart things according to a better model. And I think the one thing that I would take away from the COVID lockdown is a lot of people were then able to get back in touch with families, with themselves. There was a rest, there was a breathe. And I think a lot of people are a lot more guarded about taking the way that we work in a corporate environment. I mean, some corporate organizations expecting people to work after hours, the impacts on families. I think a lot of people are really readjusting their expectations, and they're quite happy to make some significant life changes around that to have a better life. So I think there's a great opportunity for well-inspired organizations to think out of the box and come up with creative, inventive ways. I mean, I read it. I'm partners with some guys from New Zealand, and they sent a great article out about 2 weeks ago about what you should be doing for marketing. You know, for marketing for a long time, we've been doing all this online content and whatever. And it was a great article that said, you know, maybe stop focusing on your funnel, get back to making phone calls and building relationships and really the authentic side of the connection. And
Yeah.
it's as if we're maybe going to go back to a 1930s, 1950s style of business. And I'm kind of reminded of the vacuum cleaner salesman that went door to door, is that kind of relationship, you know, the day of the salesman, not the death of the salesman. Maybe it's the reinvigoration of the salesman that was based on a relationship rather than just this kind of online plug and play disconnectedness. Who knows?
Yeah, I think that's right. If you look at what's happening in coffee shops today, I've made a few clients in coffee shops. I've had to redo the way that I work. My office space has changed as well, and there are lots of people meeting in coffee shops because I think there's such a dire need for human connection.
Yeah.
So yeah, I think that's true.
Very good. Yeah, so how we navigate that in an online space. So I think maybe the last point of contact for this afternoon is the dreaded COVID compliance officer, because I am a COVID compliance officer as well. And it's interesting that they've said industries, businesses, and entities, so those faith-based institutions, need to have COVID compliance officers as well.
And NPCs.
Yeah, the COVID Nazis, the wear your mask kind of people. But yeah. I think it's interesting. It would be interesting to explore the level of liability, because I know that in previous iterations there'd been that the COVID compliance officer would be a member of management. Yeah. I know that was in previous iterations, and so the person has to be somebody of authority. I wonder what liability they incur as well on behalf of the organization.
Yeah, time will tell.
Yeah, and interesting.
I haven't had any of those yet.
To explore, and obviously then takes us into the offences and penalties. So yeah, interesting discussion. And I wonder what level. I mean, is there obviously there's level 1, but is there a level 0? Is level 0 back to normal, or is level 1 back to normal? Yeah. Sorry?
No, level 0 is back to normal.
Okay, so I think level 1 will obviously be international trade. The expansion. So just to go back to your original statement, I think it'll be interesting to see in the next 14 days if that next spike comes along. And I would base my idea on the following 2 premises: that a lot of people who are getting COVID don't even know that they have COVID, because it doesn't display itself in symptoms that we have been told it would manifest in extremes of temperature and etc. And a lot of people that I'm aware of recently who've had COVID didn't even know it until they went for a test, because they were manifesting some strange symptoms. So yeah. I think a lot could go undiagnosed in terms of the next spike. So I think it'll be interesting to see where we go from here, but hopefully the outcome's better.
Yeah, 100%.
Raymond, it's always a pleasure chatting with you. Thank you so much for your time, and I'll catch up with you soon.
Look forward to it, man. Take care.
Okay.